Everybody, sorry we were a little bit delayed in caucus. Obviously, we had an opportunity to listen to Governor Walker, so that pushed us back slightly as we talk about the agenda that's coming forward. Today, we are going to take an opportunity to talk about the floor calendar. As you see, we are trying to focus on our forward agenda, making sure that Wisconsin is an even better place to work, raise a family, and of course, always watching out for taxpayers. You remember that since we last sat down, we have 3 task forces that are already started their bipartisan work. We have our Assembly Task Force on Alzheimer's and Dementia, Youth Workforce Readiness, and ultimately, hopefully, a good answer for urban education on the Speaker's Task Force. We're also focused on tackling benefit fraud. You've seen that our Public Benefit Reform Committee has been meeting, and they'll be bringing bills forward for a discussion later on in the fall floor period. And we know that Representative Nygren is continuing his efforts after the press conference about 10 days ago, talking about his efforts to continue to deal with prescription drug abuse. We're also focusing on more government reforms, as you heard from my colleagues who talked about making it much easier to hire people in Wisconsin as we try to get the very best workforce ready to fill the jobs that we know are needed inside state government and also outside state government. You also saw that Senator Fitzgerald and I have already announced an agreement on John Doe reform, which we hope to bring up in the October floor period, and we are rapidly closing in on an agreement on also reforming the Government Accountability Board and updating our campaign finance laws to take into light all of the court decisions that have happened over the course of the past several years. But this afternoon, we first want to talk about bills that we think are important that are dealing with increased access to medical care. My colleague, Representative Playfish, will talk about increasing an opportunity to update our adoption laws. And we have some bills that are also dealing with one of the most critical needs, and that's ensuring that we have an opportunity to have adequate medical care, especially having access to in rural areas, making sure that they have the physicians that they need to ensure that we have high quality health care in Wisconsin. So the first one I want to introduce is Representative Nancy Vandermeer, who will deal with 2 bills. The first is the Interstate Medical Compact, and the second is allowing for some flexibility for a local school board member. Representative Vandermeer.
Thank you, Representative Voss. Good afternoon. On AB 253, the Interstate Medical Licensure Compact, basically in Wisconsin currently, a physician who wishes to practice has to be, of course, licensed in Wisconsin. If we would like to have a specialist or a physician from another state practice within our state, they may encounter sometime a burdensome process taking 3 to 6 months in order to facilitate that licensing process. Of course, we have a shortage of physicians, mental health care practitioners in our state, and what this bill will allow Wisconsin to do as a member of a compact is to be a member of a clearinghouse of the physician licenses from other states so that those physicians can easily get a license once they have passed the compact and enter into practice into Wisconsin. As I said, it will help with telemedicine diagnosis. It will also help with mental health care and also with the transition of physicians into our state to practice, excuse me, especially in rural areas. Do you have any questions?
So if somebody passes this compact, are they automatically granted licensure in all of the states in the compact, or do they have to request which states they want to be licensed in?
As it stands right now, the compact is brand new. It is forming with other member states, but the intention would be that they would be able to get a license in other states easily as well. And I do want to highlight that this process does not circumvent our Medical Practice Act in the state of Wisconsin, and it is voluntary, and it would not circumvent our usual medical examining board either.
What kind of oversight would the state have over this then?
We have 2 members from our medical examining board who would be members of the compact board. So we would be essentially in the ground floor of the development of the compact.
And the most important point, of course, is that all of the laws of Wisconsin, all of the requirements for any physician stay in place. It just allows them easier access to the other opportunities to practice.
That's correct. And it is voluntary, so it does not preclude any of our processes, as Representative Voss indicated just now.
Would there be any revenue from the fees and licenses in this?
Yes, that DSPS is allowed to set those fees and bring those forward from the physicians who would be involved in the compact.
Okay, any other questions about that? All right, do you want to talk about your second bill, please?
Yes, the second bill is the volunteer coach bill. And this really is, as one of my constituents said, I believe it's government at its best. Currently in the state of Wisconsin, state statute prohibits a school board member from being a volunteer coach in the school district in which they preside. This bill would allow them to be on the school board and to be a volunteer coach as well, or an extracurricular director. And they would abstain from any issues that would come before the board, the school board in their district, that would be in direct description of the team that they would be working with. So very simple bill.
Okay,
Anything
very
else?
much.
Thank you.
appreciate that. Next up, we have Representative Tom Weatherson, who's going to talk about his bill dealing with school board vacancies. Representative Weatherson?
Good afternoon. Wish I could get this many people to show up at my fundraisers, but AB 325 does two things. One, the simple one, is it requires all school boards across the state to establish policy and procedures on how to react if they have a tie vote on any issue, especially when it comes to an absentee board member. It also allows one time for the Racine Unified School Board president to appoint a person to an open position that's on that board now. So it's a one-time, one-shot appointment. He doesn't require him to do it. He can do it if he wishes to do so. And that seat has to be reelected in the April election. Any questions?
Any questions?
Who handles your fundraising?
Thank you.
Next up, Representative Clayfish will talk about the bills that he has been working on dealing with the Ledge Council Study Committee on Adoption Reforms. Representative Clayfish?
Thank you, Speaker Bloss. A lot of these bills are frankly kind of inside baseball as it pertains to adoption in the state of Wisconsin. We started last year with making it illegal to advertise children for rehoming or readoption on the internet, and we also had in there that you had to go through a process, not just a power of attorney to turn over your child to someone else, which is the way the law was. In doing that, we put together a legislative council study committee this summer. We learned the ins and outs of adoption in the state of Wisconsin and found out how antiquated some of the adoption laws are. I'm not going to go bill by bill on this package, but what it does, in essence, is gives adoptive parents more avenues, more support, more ability to make sure adoption's the right choice for them, and when it is, it gives them the resources to continue with those adoptions, because we're hoping with these bills to reduce what is called rehoming, or that is adoption disruption or dissolution. What that means is you have an adoptive family who no longer believes they can care or facilitate the care of an adoptive child. That is incredibly difficult for the child in these adoptive circumstances. So not only do we improve the resources adoptive parents have, we also improve the resources they have if they're having trouble. We also allow more tools in the toolkits for those who deal with adoptive parents and adoptive children. If a rehoming or a dissolution case were to be coming up, the more people who know about the intricacies of those specific cases, the more they will result in a successful readoption, if that should be the case. I think the biggest bill that we do in this package that will have hopefully a substantial impact is AB 41. Right now, a lot of people don't realize, and I want to say our bills that passed last session are now models for national legislation, and as many as 23 other states are looking at our legislation as a model. And we believe that the same thing's going to happen with these bills. AB 41, many people don't realize, when a child's adopted from a foreign country, there are no requirements for readoption in the state of Wisconsin. The problem lies in that the child coming from another country may or may not have a valid birth certificate, may not have a valid or legitimate identity. The problem with that when they come here is that many children who end up in dissolution circumstances or circumstances of adoption here have no base identity. And that is the most easiest picking for those who would do harm to a child. The child who has no identity and doesn't exist on someone's radar screen is the child that is optimally looked for by people who would do harm in the sex trade industry and the child slavery industry. And we know that Chicago, which is only an hour and a half away, is a large hub for that. So what we do is require readoption in the state of Wisconsin from a foreign jurisdiction. This will make a big difference on knowing who the children are so we can make sure the course is taken. And ensuring that as they grow up here in the United States, they have an identity and they are able to be protected. So I'm real proud of the work we did with Ledge Council and Representative LaTanya Johnson, who was integral in these bills, and their leadership. Peter Barca was strongly supportive. We have real strong bipartisan support. Every one of these bills came out of the council committee on 12-0 votes. And while it's going to take a little more state resources, there's no doubt in my mind that we're going to make the adoption process in the state of Wisconsin smoother. We're going to make it better for the adoptive parents, the potential adoptive parents, and the kids.
Questions?
And, well, there you go. Dom, how are you? Good.
Next up, Representative Jock is going to talk about the bill which will change the way that we apply for Title X family planning funding in Wisconsin. Representative Jock.
Thank you. Well, and actually, having served on the Adoption, Disruption, and Dissolution Legislative Study Committee, I just want to applaud Chairman Clayfish for his leadership. He did a fantastic job with that committee and putting some very good measures forward, and also through the joint finance process. So if I could just say that, I really appreciate the opportunity to serve on that committee. Assembly Bill 310, I'm very pleased that we're bringing this forward because it's going to allow the state of Wisconsin to expand its network for public health and preventative health services. Currently, there is $3.538 million allocated by the federal government to the state of Wisconsin, and the sole recipient of that, the sole direct grantee, is Planned Parenthood, which largely has distributed to its clinics. Now, what we have seen, and we just had another hearing on the bill in the Senate companion bill earlier this week, Planned Parenthood, while even being in the hearing room, has refused to testify or talk about how they utilize those dollars. I think that's not only because of the questions that have been raised at the national level about the organization, but the fact that if you look at Planned Parenthood's national annual reports, which they don't provide the same specificity at the state level, but we see that over $127 million is what they term excess revenue over expenses, essentially the profit that they generated. That's from, on their website, the 2013-2014 annual report. Now, we know that over 90 million of that comes from their affiliates within the states. And again, they didn't testify as to how they're using that, but we had testimony at the hearing from a former Planned Parenthood clinic director talking about the double dipping and the billing practices, the ongoing lawsuit that's occurring. And when you look at their overall net assets of over $1.4 billion, clearly that Wisconsin has been subsidizing Planned Parenthood and really lost an opportunity to expand its provider network, because these are not funds that are on a per service basis or even that all services have to be rendered at any particular facility, but rather based just on the fact that they're the ones that have applied and thus they're the ones receiving them. Again, we know that there's an excess subsidy that is occurring, so they're not going to shut their doors, but they are benefiting from taxpayers. Those funds should be going to our county and local health departments to be able to determine where those funds should go. Things like the Wisconsin Well Woman Program, where we have breast and cervical cancer screening, things that are very fundable under Title X, which includes a broad array of services, everything from family planning to breast and cervical cancer screening, diabetes, blood pressure and anemia screening, STD testing, HIV/AIDS testing. And so, really what we're doing is saying that the state is going to apply for these funds. If we don't, we're basically saying that there's no purpose to the State Department of Health and Human Services, or the state DHS, that essentially Planned Parenthood knows better than the state of Wisconsin what to do with Title X funding. So this is up to $3.538 million that's going to be available to the state, and I think it's something very positive. Again, we had support from several county executives, including County Executive Ziegelbauer, County Executive Farrell, County Board Chairman Chippewa County, asking for these funds because we have been petitioned as legislators in the past for the lack of funding for communicable disease prevention. So we are currently one of only 3 states in the country that uses Planned Parenthood as the sole grantee. This is going to, again, not prohibit Planned Parenthood from applying or receiving funds, but this is going to say that the state of Wisconsin is going to compete for those funds. We're going to try to end the monopoly and put forward a state vision for where those funds should go. Be happy to answer any questions.
What would your sub do that's coming into it?
Sure. The sub largely, a lot of it is housekeeping. It moved the order of the Well Woman program within the sentence because that confused a few people. It doesn't change the meaning of that sentence. It basically says that for 2018 and ongoing, because that's the next grant application deadline. The previous wording just said annually. That could be confusing. DHS was not planning to apply until 2018, whether we change that language or not. But we removed the referral requirement, but basically said that this funding cannot go to abortion providers or affiliates of abortion providers. And then basically, in a non-statutory provision, said that we're going to utilize existing personnel and appropriations for this biennium, that essentially there's not going to be any additional state funding that goes into this, that this is something that the DHS already has the capacity to do.
Democrats are under the impression it would make it so that providers, they don't want to, don't have to administer birth control, don't have to do STD testing.
No, you're thinking of, there's already something that was in the existing bill dealing with the individual right of conscience that we already have in many other areas of the state, particularly related to abortion services or other matters of conscience where you can, as an individual, choose not to participate in certain things. So, for instance, if you have a county health department that might choose to use these funds to increase services, to offer services that they currently don't have the funding to be able to do at the county level, this will allow for them to administer those services even if there might be an individual who works for the county that does not want to, say, participate in family planning, counseling, or referral.
Can you clarify earlier the concerns with Planned Parenthood not being specific, not clarifying how they're using this funding? Is that part of the reason why you're not giving having them have it all?
Well, I mean, I think certainly if they have a plan for why they feel that they are the best possible recipient for these funds, they certainly have not made that case or talked about how the funds are used because, again, there is no matching requirement other than that Title X funds cannot provide 100% of the funding for any particular entity or program. So clearly the matching funding doesn't apply in any of these cases because you're talking about existing providers. But I think it was certainly very puzzling when we had 2 bills in particular, AB 310 and AB 311 and their Senate companions, SB 237, 238, where it's dealing directly with a billing loophole that Planned Parenthood benefits from, as well as Title X funding where they are the sole grantee. The fact that they were unwilling to justify either their billing practices or their use of Title X dollars, I think that's a story.
Okay, thank you very much. Last bill on the calendar today that we're going to have in our press availability is Representative Sanfilippo. It's a bipartisan bill on making some changes to the school choice program. Representative Sanfilippo?
Thank you, Speaker Buss. So with some of the changes that were made in the voucher program throughout the budget, one of those changes involved the way the formula was arrived at for establishing the cap in a voucher school. So prior to the change, only students coming from a public school going into a voucher school were counted under the cap. So it could be possible, for example, for a school district maybe to have 12 voucher students in there, but only 4 of them were counted under the cap. With the budget change, every single student is now counted under the cap. So you're running into a situation you could have, for example, 12 voucher students in that school that I mentioned before, but maybe the cap is set at 10. So there's now 2 students that are over and above the cap that would not be able to continue to attend that school without this change that we're doing in this bill. So, as Speaker Voss mentioned, this has been a bipartisan bill because no matter where you fall on the voucher issue, nobody wants to see a child have to be uprooted from a school and moved to another school because of this change. So this is about a temporary fix, really. After 1 year, the cap increases by 1% every year, so it's just this initial year where this problem has occurred, and this bill takes care of it.
Any questions? Okay, thank you very much. All right, we have a few minutes. We're going to start at 1:30 today.
Where do you stand on fetal tissue ban? You got most of the votes yet? I understand Representative Jock says he has the votes.
Sure. We just had a good discussion about that in caucus. As you know, the next time we're on the floor is going to be October 22nd. So we talked about trying to see if we're able to continue to work together so that a majority of our caucus, or not a majority, at least 50 members of our caucus can vote for a bill that goes through the calendar. I am very optimistic that we are going to get there. I think that we have offered some very good ideas that have almost no impact on the substance of the bill, but address some of the concerns that members have to ensure that we will not see any reduction in research. So we're not ready to announce what those changes are, but I think that there's a lot of possibilities. I've worked with both Representative Jacques and Representative Clayfish to see if we're able to do that. So once again, optimistic that the bill will pass. We still have to work on some details in order to get it through with hopefully unanimous support from our caucus.
So you're optimistic you'll take it up in October?
Sometime in October, yes I am, yep.
And that will allow research, those changes that...
That's our goal. That's exactly what we're working on, to ensure that we have an opportunity for ethical research to continue in Wisconsin, but do it in a way that doesn't require the sale of fetal body parts or to do things in what I think most Americans consider not just an unethical but a disgusting way of selling fetal body parts.
So at this point, you still do not have 50 votes, but you're optimistic you can get them by October 27th?
Yeah, I mean, I think we're getting very close. I think that we will find a way to get consensus. We now have a month for the authors to sit down with some of those who want to see if there are other ways to achieve the same goal. I think all of us know that when you introduce a bill, you then have the opportunity for the public to give testimony, you listen to your colleagues, and you try to fashion a bill that has the best possible solution. The bill that came out of committee is a good solution. I support that. I have from the very beginning, and I've told the authors that. But if there's a way that we can do it to address some of the concerns that have been raised, achieving the same goal, I think that's what we're going to get to.
Do you support all of the civil service changes that are proposed?
I want to be honest, I support the goals of the civil service. I haven't read all the details of the bill, but I certainly think that the idea of saying we want to have a system that makes it much easier to hire folks to work for state government is one that should hopefully have broad-based bipartisan support. I think it's easy for a knee-jerk reaction from some members just to simply say, you know, if it's controversial, we're a no, and to try to take political advantage of it. When the reality is, and I'm sure the authors, I'm sorry I wasn't here for their press conference, but I know they probably talked about the demographic challenges that we face as a state. We have a lot of workers who are doing a great job for state government, but they're nearing retirement age. And we want to find a way to make sure that we are nimble, because civil service obviously was put into place way before we had an opportunity for even banking together resumes so that different agencies can share resumes to find the best person for a job as opposed to each individually. So I think there's a lot of good concepts in there that focus on the most important part of the civil service reform, which is to get the very best people in state government, and to do it quickly so those jobs don't sit vacant where the public is either not getting services or they're not getting it as efficiently as they should be.
The Department of Administration a year ago was talking about more limited changes to civil service. Just what's been the process since then to now? I mean, was this something that the Walker administration had put forward with all these details, or are the lawmakers doing this independently? What's your understanding?
It's my understanding that the administration, the Walker administration, has been working with the authors of the bill to make sure that we address the concerns. I think that from my discussions with Governor Walker, it seems that he wants to have the same goals that I do, which is to ensure that we get the most qualified people hired in a process that is fair and nonpartisan, but to do it in a way that speeds the process up. I mean, when you hear the stories where people are literally waiting 150, 200 days to get a position filled, you know, as a conservative, you then begin to say, well, if a job can go for almost 6 months without somebody in it, do you need the job? So if we certainly do, I want to get those people hired quickly. So a reasonable process in the private sector is 30, 60, 90 days at the outside to have somebody able to work in that position. That's our goal.
Representative Mark Pocan is calling on Governor Walker to call a special session to deal with infrastructure issues. After the DOT came out with a list of what is going to be delayed and the delayed timelines, he says some of those aren't acceptable. What do you have to say to that?
Well, as you know, Mark Pocan is a good friend of mine. There are some days where I wish he was back here, quite honestly. But this is one of those where, you know, I have not sent a whole lot of letters to the U.S. Congress about what they should be doing in their area. And Mark and I agree on the need for infrastructure. I think that's certain. But I think that the idea of having a special session, I think we have plenty of time to do it in our regular session. And hopefully we'll be able to continue to work toward a solution that gets projects funded. The first most important is to make sure we have that joint finance meeting so we can get the contingent bonding going. And that's part of what we're working on.
How quickly do you think the Walker campaign should pay back the state for DPU expenses?
I think they're already in the process of doing that. I mean, I read a press report this morning that said they'd already cut a check for part of it. It seems to me that, you know, they'll be working on those processes as they wind down the campaign. Unfortunately, as we all know, Governor Walker wasn't successful in his efforts, but I certainly am glad that he's back. He got a rounding, you know, he got a very raucous applause, as many of you saw from our caucus, so many of us are excited about the opportunity to work with him, continue the reforms that we are working on in Wisconsin, and to get us in a better place than we are today.
All right, thanks everyone.
Thank you.